Excellent. Welcome, everybody. Thank you so much for being here. And we are really very excited to be able to just start the evening with a video address from Dr. Tedros, the Director General of the World Health Assembly. So we'll play that now, and then we'll move on to the formal program.
Dear colleagues and friends, unprecedented flooding in Pakistan, drought in Africa and Asia, fires in Europe. We live in a time of multiple overlapping and related crises. And many of the victims of this crisis need surgical care. As usual, the poor and marginalized suffer the most, both from the impacts of climate change and the lack of access to quality surgical care. Globally, 5 billion people do not have access to safe and affordable surgical care, mostly in low and middle-income countries. As we work to close this gap, we must also work to prevent and mitigate this crisis by investing in renewable energy and climate-resilient health facilities. Earlier this year, WHO established the Alliance for Transformative Action on Climate and Health, bringing together 60 countries that have committed at COP26 to reduce the carbon footprint of their health systems while also making them more climate resilient. WHO is also supporting countries to expand their capacity in primary and emergency care to provide accurate and appropriate surgical referral. And we're providing guidance and training on how best to integrate care across the continuum of emergency, critical, and operative services. Thank you all for your commitment to highlighting these crucial issues. We look forward to working with all of you to accelerate access to timely, high quality, and climate-friendly operative care and build a healthier, safer, and fairer future for all of us. I thank you.
Excellent. Yeah. Video address. I am really honored to welcome all of you here tonight for this important United Nations General Assembly side event on sustainable surgical systems and planetary health. As you just heard from Dr. Tedros, this is an essential issue, but it's also essential that we have operative care that can be done in a climate-friendly way. So we're very excited to chat about that tonight. I'm Erin Stieber, the Chief Program Strategy Officer for SmileTrain. And on behalf of SmileTrain and our co-hosts at this event, Lifebox, the Harvard Program in Global Surgery and Social Change, the G4 Alliance, the International Federation of Surgical Colleges, Mobile Surgery International, Kids Operating Room, and ReSurge International, we are so happy to have all of you here with us tonight. Sustainable surgical systems and planetary health is a very important topic. It's also a complex and challenging topic without easy answers or easy solutions. Not to put additional pressure on our panelists. But seriously, the event isn't about getting easy answers. We want it to be about connecting the people who are asking the questions, sharing knowledge and gaps in knowledge, and learning from each other's work and experiences. I hope that tonight inspires those new connections as well as new actions and partnerships. I think we're ready with our special guest, so I am incredibly honored to introduce our keynote speaker, His Excellency Prime Minister Frank Bainimarama, who is the Fijian Prime Minister, and we are incredibly grateful to have him here with us tonight. So I'll invite him up to the podium now. Prime Minister, we are very honored to have you here with us today, and we invite you up to the podium now to give some remarks and begin this important conversation.
Thank you.
Excellencies, excuse me, ladies and gentlemen, good evening. Excellencies, it is truly a pleasure to be here with you. You see, I'm among the many who are indebted to surgeons and the modern day miracles they perform. I stand before you healthy today because of a bypass operation I underwent earlier this year. So let me begin by saying, which is thank you to the members of the global surgeon family here for the lives I know your talents have saved. We need your expertise and initiative today more than ever. Of course, I'm not a doctor, and I have only an interested layman's knowledge of medicine, but I don't need a medical degree to diagnose the deteriorating health of the planet. And even my grandchildren in primary school can tell you that the deteriorating health of our planet is very bad news for humankind. Climate change especially presents us with serious challenges in expanding the reach and lowering the cost of surgical care. We not only have to fight to bring medical care to every person in every community, no matter how poor or remote, we also have to protect the systems we have built and the care that many people have become used to and even take for granted. Fijians know from the devastation we've endured that the climate crisis is the health crisis. Stronger storms can kill. Heavier floods can cut off access to health facilities. Droughts can starve crops, and the rising seas can swallow entire communities and ruin arable land, seriously threatening food security and general nutrition. I cannot stress enough, these are not projections. This is happening now. It happened this week in Puerto Rico. It happened last month in Pakistan. It is happening daily at the shorelines of the South Pacific. 5 Pacific Island countries make up the top 15 nations most at risk to disasters globally. In Fiji, we've relocated 6 communities to escape the rising seas, and we have over 40 more in the queue to be followed. 14 cyclones have struck us since 2016, the worst of which, Cyclone Winston, wiped out 1/3 of the value of our GDP in 36 hours. That, ladies and gentlemen, is the equivalent of the United States losing the combined GDP of California, Texas, and New York over the course of a brutal day and a half. We have seen brilliant flashes of Fijian heroism and resilience during these disasters. One of those storms, Category 4 Cyclone Harold, arrived in the early days of the pandemic when Fiji was dealing with its first wave of COVID-19. Our officials managed a disaster response in some of our most remote island communities without spreading a single case. Through an exhaustive contact tracing effort, we went on to eliminate the virus completely. And for a full year after, Fiji was COVID-free. We have since vaccinated virtually every adult and reopened the country to the world. You're all very much welcome to visit. Climate change has driven a sea change in how Fiji pursues development. The same trend is true among all small island countries. We have to see the extent of the devastation we've endured to even believe it. When you do, you draw the same conclusion that we did. We have to rebuild to the standards of a warmer world. That applies to homes, that applies to roads, that applies to schools, and it certainly applies to hospitals and health facilities. Making surgery accessible to people living in over 100 populated islands was already a daunting challenge. Doing so in the face of an existential crisis like climate change demands resources that are scarce and time that is fast running out. The pandemic, ladies and gentlemen, added to the urgency while pushing finance further out of reach. 2 years of border closures brought on 2 years of the worst economic recession in Fijian history. It meant delays in shipments of medical equipment for our geographically remote economy and the health sector. Small countries were at the mercy of a, frankly, unaccommodating global financial system. We had to triage, as they say, in emergency rooms and redeploy finances to help Fijian families make ends meet. That held up some planned development. But I'm glad to say our borders reopened last December and we are on the road to recovery. It is a long road, but we are moving forward quickly. We will not stand still and cast our faith to chance, and we are certainly not going to take one step back. Just as we've had to climate-proof our hospitals and health centers, climate resilience sits at the center of our health policy. With like-minded surgical specialists from our partner countries, Fiji launched the SUVA evidence-based surgical, obstetric, trauma, and anesthesia care in low and middle income countries on the margins of the World Health Assembly this past May. Its 11 best practice strategies were developed through a review of 40,000 literature and surgery cases in low and middle income countries. Its aim is to save lives through more universal access to surgery and other advanced medical treatments, a mission that Fijian doctors and nurses live and breathe. Ladies and gentlemen, I'll give you a brief idea of where we stand today. For one, healthcare in Fiji is free. We even sponsor visits to private general practitioners and dental clinics for all Fijians who need that support. Our network of healthcare extends to some of the most remote rural and maritime regions of the country. And we have developed a medical assistance team known as FIMED, the Fiji Emergency Medical Assistance Team, that provides medical treatment, including surgeries, on board a ship called Envoy, a word in our Tokay language that means to help someone in a time of need. It makes regular stopover in maritime communities to perform surgeries, as well as to provide pediatric, obstetric, and other specialist services. In some cyclone seasons, it has been deployed almost continuously to the front line to offer life-saving medical care. Soon, a newly upgraded hospital in Fiji's Western Division will make cardiac surgeries available in Fiji 24/7 for the first time in history, thanks to a partnership with the Australian healthcare company Esplan Medical. And we are pouring new funding towards scholarships and loans for students looking to enter medicine to offer more specialized care in country. There is much more we'd like to do through partnerships with the right countries and organizations. I can't stress enough how welcome overseas doctors are in Fiji to help us build capacity and even offer surgical services to our citizens. It would be an experience of a lifetime that would save lives, and we seek partnerships with medical and educational institutions to make more of these exchanges possible. We also bear a crisis of non-communicable diseases along with climate change and COVID-19. We've lost more than 10 times the number of Fijians to NCDs during the pandemic as we did to COVID-19. That is a crisis that is not going anywhere. And it is one of our people wish that the world treated more seriously. So on behalf of Fiji and every small island developing state, I'd like to echo the call of the World Health Organization to support our nations in overcoming our challenges of scale, geography, and increasing vulnerability to climate change. And to the many experts in this field here with us tonight, please know how valued your contributions will be to the Fijian people, and indeed to all people who face the wrath of climate change and difficulties in accessing the life-saving services you can provide them. So in thanking you again, ladies and gentlemen, for what is all that you do for your patients in the world, I look forward to what more we can do together. And I'm going to thank you.
Absolutely right. This climate crisis is a health crisis, and similarly, as we address health needs, we have to do so in a way that is climate friendly. And you know, I think there's so much that we can learn from all of the services that you've made available in Fiji and the help you've been able to provide to people. But as you said, there's so many more opportunities for us to forge meaningful partnerships to support each other and learn from each other. And we know you have an incredibly busy week here, so we are beyond grateful to you, Excellency, for taking some time to be with us tonight and to start our program off in this way. So thank you very much for being here. Now I would love to invite our panel moderator up, Mark Goldberg, to come on up to the stage, I guess after I finish introducing you. Many of you may have heard Mark's voice a lot this week. Mark is also very busy with all of the activities taking place here alongside UNGA. He is the editor of the United Nations and Global Affairs blog, UN Dispatch, and host of the Global Dispatches podcast. His work has been featured in the New York Times, The Guardian, The American Prospect, Foreign Policy, The Globe and Mail, The Los Angeles Times, Newsweek, The New Republic, and The Daily Beast. So quite a list there. And he also appears regularly as an on-air guest for Al Jazeera English, National Public Radio, personal favorite, the BBC, and HuffPo Live. So Mark, thank you for joining us in what is a very busy week for you, and we're really grateful to have you guiding the discussion.
Thank you, Erin. Thank you to Dr. Tedros and to His Excellency the Prime Minister for his opening remarks. I'm excited for today's panel discussion. I will invite them to the stage now, and you guys can come on up. I'll have some introductory remarks, but coming up, and we're waiting on one more panelist who is, oh, she's right here. Excellent. There you go. Have a seat. Traffic is a little intense this week. But please, yeah, have a seat. So this is my favorite week of the year. Not only because as a journalist, I'm intuitively interested in all the diplomatic drama that's happening at the UN, but as a global citizen, what I think makes this week so meaningful is the fact that it provides a platform and a venue for conversations like this one, in which well-meaning global citizens come together to discuss cooperative solutions to common global problems. And that's really what UN Week is all about. This week in particular, there are two common through lines that I think will inform our conversation today. One is a focus on universal health coverage. Next year at this time, at the 78th General Assembly, there is a key meeting on universal health coverage, and a lot of the conversations that are happening inside the building at the UN and elsewhere are in preparation for that. And of course, as this audience well knows, in just a few weeks, the world will gather once again in Sharm el-Sheikh, Egypt for COP27, and a lot of conversations similarly this week are in preparation for that key meeting. And I just think that these two issues, universal health coverage, climate change, fits so nicely into our conversation today, sustainable surgical systems and planetary health. So I know we have some attendees here today who are not very familiar with one or the other, and probably some attendees who aren't familiar with either, but are here for the conversation and for the cocktails afterwards, perhaps. So let me sort of have some brief introductory remarks to set up this conversation. So in thinking about delivering these remarks, it's sort of notable that I live in Denver, and about now, actually, my daughter, 9-year-old daughter, is going under general anesthesia for a very minor dental issue. It's not a huge thing, but how sort of fortunate it is that I didn't think twice about that. And not only how fortunate that is, but how indicative that is to the inequity around this situation and to the access available to someone like me and my daughter who can easily access it without thinking twice, and the 5 billion people in the world who lack access to safe surgery. Access is worse in low-income and lower middle-income countries where 9 of 10 people cannot access basic surgical care. It's essential to treating a wide range of conditions, including infectious disease, maternal disease, neonatal disease, non-communicable diseases that the Prime Minister noted is so is so problematic in Fiji. These can be treated, but they can become deadly if surgery is not available. So not only is safe surgical care an important component of surgical systems strengthening and universal health care, but it also cuts across a number of the sustainable development goals, including poverty alleviation, healthcare for all, sustainable economic growth, infrastructure, greater equity, environment, the promotion of peaceful and inclusive societies, and sustainable development. Basically, all of the 17 sustainable development goals are in one way or another impacted by access to safe surgery. In May 2015, the World Health Organization member states provided their unanimous support for World Health Assembly Resolution 6815, which recognizes the role of emergency and essential surgical care in anesthesia as an important component of universal health coverage. Governments, organizations, and stakeholders around the world are working to strengthen surgical systems and integrate it into policy and funding at the international and national level, but scaling surgical systems to address the growing need is a huge challenge, and there is an urgent need for increased prioritization, funding, and partnership to close this gap, and that's a lot of what we'll be talking about tonight. But if that is not daunting enough, this event today is focused on how we approach building sustainable surgical systems through the framework of planetary health. Now, if you are not familiar with the term planetary health, a helpful definition I can share with you is this. The United Nations Framework Convention on Climate Change recognizes that human health and the health of our planet are inextricably linked, and that our civilization depends on human health, flourishing natural systems, and the wise stewardship of natural resources. Planetary health recognizes the health of the planet as a system, and that even its non-living components are wrapped up in the state of well-being or disease. So with this background in mind, I am delighted to introduce our panelists. I'm going to grab this mic and take our seat and introduce our panelists. We'll have some questions for the panelists, and I'm going to leave plenty of time for questions from the audience. So think of your questions as I introduce the panelists and we get this conversation going. Dr. Craig McClain is Interim Division Chief for Perioperative Anesthesia, co-director of the Neuroanesthesia Program and director of the Global Pediatric Anesthesia Fellowship at Boston Children's Hospital. He is also an associate professor of anesthesia at the Harvard Medical School Program in Global Surgery and Social Change. Thanks for being here. Dr. Omrani is the first official youth envoy for the COP27 president and a plastic and reconstructive surgery resident from Egypt. She has more than 7 years experience in climate change and facilitated over 74 hours of training sessions and workshops in 15 countries across the world. She is a commissioner at the Lancet Chatham House Commission on Post-COVID Population Health, an associate at Women Leaders for Planetary Health, and a member of the Global Youth Coalition for Road Safety and UNICEF AZ Youth Leaders Program. She has attended the last 3 UN climate change conferences in Katowice, Madrid, and Glasgow, representing more than 1.3 million medical students worldwide in the International Federation of Medical Students Association. She has also co-authored a narrative review on sustainable and resilient surgical care systems in the Western Pacific region. Welcome, and thank you for making it here. Susannah Schaefer is the Executive Vice Chair President and Chief Executive Officer of SmileTrain, the world's largest cleft-focused organization. SmileTrain partners with more than 1,100 treatment centers around the world, providing funding, resources, education, and training to increase capacity of local medical professionals and health systems to provide care to patients in their own communities. And lastly, Gareth Wood is a Scottish philanthropist and advocate. He and his wife Nicola founded the nonprofit Kids Operating Room, whose team works directly with ministries of health, local surgeons, and their teams to transform operating rooms, pre-op and post-op rooms in their hospitals into dedicated spaces for children's surgery. Gareth firmly believes that access to surgery is a basic human right and that every child should receive urgent health care when they need it. Sadly, this isn't the case across many low and middle income countries, which is why Kids Operating Room created an innovative and sustainable solution, removing the barriers to surgery for the world's poorest children. Thank you so much for being here, Gareth. All right, so let's jump into things. Craig, I'm gonna start with you. In your published article titled Climate Change Challenges and Opportunities to Scale Up Surgical, Obstetric, and Anesthesia Care Globally, you discuss the many ways in which planetary health, specifically climate change, affects surgical and anesthesia care and vice versa. Can you speak to this intersection between surgical care and anesthesia care and planetary health?
Thanks, Mark. Just as an aside, I trained a lot of pediatric anesthesiologists that are in Denver children, so your daughter's in good hands. The issues of climate change and scaling up global surgical systems are inextricably linked. When you look at healthcare systems, certainly in high-income countries, healthcare systems contribute about, depending on what system you're looking at, around 10% of the carbon footprint of any given country. And out of that 10%, perioperative systems, surgical systems, contribute about 20 to 30% of that, depending on what you're looking at. So there is a huge climate cost to simply doing surgery and sort of the routine things that we do to take care of people. And that has to be borne in mind with the fact that climate change, as Mark has alluded to and as the Prime Minister has discussed, is a real problem. I mean, it's not a theoretical issue anymore. It's here on our doorstep. It is affecting nations, particularly in the Western Pacific, but all over the world. And so knowing that climate change is such a huge issue, and healthcare, and particularly surgical systems, what we're interested in and we're talking about today, contributes to that. The real issue becomes how do you address some of the just overwhelming numbers that the Lancet Commission on Global Surgery demonstrated. 5 billion people lack access to safe surgical care. 1.7 billion kids It's unfathomable. And so how do you address those needs, those basic human rights of universal health care, while being responsible and not making the planetary health situation worse? Well, stop there.
We'll answer your non-rhetorical question later in this conversation for sure. But for now, let me turn to Omnia. As a plastic surgeon and the first ever COP27 President Youth Envoy, you have a unique perspective on surgical systems and planetary health. First, do you have any additional thoughts on the linkages between the two? And what challenges do you see for the global health and global surgical community in addressing inequities in access to care within the framework of planetary health?
Can you hear me?
Very well.
So first of all, thank you so much for having me. I'm very happy to be with you today. And then in terms of the additional linkages I want to add, so first I'd like to add it from my personal experience. So right now I'm a second year resident doing plastic surgery in Cairo, in Egypt. And as many of us, I've spent the first year every day at the ER. And I've seen on a daily basis, especially when the summers hit, the patients coming in, presenting with exacerbations of asthma because of the high levels of air pollution that we have in Cairo. And this has tremendously prevented them from getting the surgical care that they need because of their comorbidity. And then I also saw many patients coming in on a daily basis presenting with acute heat stress because of the increasing temperature that we are not getting used to. But what I've also seen that made me very worried is that the tendency of this being misdiagnosed because it's not commonly seen as we are seeing it right now as the temperature is increasing every year. And at the same time, I also see how carbon intensive my healthcare facility is. And I work at one of the biggest public hospitals in Cairo. And I also see this distinct gap in the understanding and the realization of the obligation and the duty that we have as surgeons towards not just our patient, but also towards the community, and how climate change is now the biggest global health threat to our patients and to our communities. But then on the other hand, as a climate activist, and I started working on climate change since I was a second-year medical student, working with the Federation of Medical Students Association and seeing young climate activists both in the health space, but also on all the diverse disciplines that I had the opportunity to work with, going to the last climate change conferences over the past 3 years. And I started understanding and seeing the urgency that young climate leaders bring in and the seriousness of acting on climate change, because not just climate change is a health crisis, yes, but it's also a crisis that brings in a lot of injustice, both on an intergenerational level, also on the gender level, because now more women lose their lives due to extreme weather events. More women are exposed to indoor air pollution, so more women are also have a higher morbidity and mortality because of air pollution, which already kills 7 million people every year. And a child that is born today is going to witness 4 times the number of extreme weather events that we're seeing right now, which also contributes to child mortality and morbidity. These are numbers, but these are also personal stories that we are seeing as the health community, which means that it is our duty to put the face and bring in the personal stories, the human aspect of climate change, so that we can build the resilience, the understanding of our community, and build the urgency that is needed to tackle the political inaction and inadequate response to the climate crisis that we see every day, either at the climate change conference at COP and also on a governmental level. So these are the challenges that I see, but I also see the opportunities that we bring as a health community, because we have the power to turn the climate crisis into the narrative of building in a greener, a healthier future. We bring in the health co-benefits to climate action, because it can be as simple as seeing it across 3 levels. First, on an individual level. So if I, Omnia, who is a doctor, but I also choose to go to my hospital, to go to work, I'm not going to use my car, I'm not going to use public transport. I will choose today to use my bicycle, or I'm going to walk, or I'm going to run. This means that it's good for the environment, but it's also good for my health, my physical health, as well as my mental health. but then taking in these local solutions and looking at the solution from a community level. How can I work with my members of my community to raise awareness about climate change as a human health crisis, but also as a human health opportunity, but also as a young doctor and part of a community? We are the trusted messengers of our community. And when we deliver in the climate message, our communities trust what we say because we are the messengers for them. So I leave it at this.
Thank you. Thank you so much. Susie, over to you. How does Planetary Health intersect with the work of Smile Train and its partners and patients? And what do you think the role of NGOs should be in this? What unique challenges do you think NGOs face when it comes to integrating Planetary Health into their work?
Thank you, and delighted to be here. So for cleft lip and palate, there are many factors that, obviously for the condition that we're treating, there are environmental factors there. So cleft lip and palate, when you think about what causes it, there is a combination of environmental factors, genetic factors. So when we think of our patients and who we are treating, and the importance of this conversation with where our work is taking place, we are working with our partners in low and middle income countries. So they are facing and seeing these challenges, as you just heard Omnia raise. So when we think of NGOs and the work that we can do as a cleft organization, I think for Smile Train, what's really important is when you think of our model of care for cleft treatment is one of sustainability. So it's a sustainable model where we empower local medical professionals to treat children in their own communities. So we are there listening to them on the ground with our team. But you have to remember that they're working in austere settings, and they are treating patients who are in austere settings who are faced with the challenges when you think of factors that impact planetary health. So there are financial concerns. So our patient families, our patients are the poorest of the poor. They don't have the financial means to be able to have access to cleft care and the financial means to be able to cover the cost of surgery. So that's where Smile Train steps in. There are also obviously challenges with regards to climate. So you heard Dr. Tedros in his remarks speak about Pakistan and the floods in Pakistan. So you think about that, you think of our partners in Pakistan, you think of our patient families in Pakistan, and how did they overcome the challenges to get to care. So, our role as an NGO is to be able to provide for our partners. And I think what's so important with regards to our sustainable model is having our partners who are on the ground, we have our staff who are on the ground, and we're listening. We're listening to the challenges that are there. We're listening to our partners for what they need, being able to provide for them. And then as NGOs, it's obviously working together to align together to leverage each other and accelerate. How can we accelerate together as partners to be able to meet the needs of our patients and to be able to provide the cleft care that's needed?
Thank you. Gareth, what are the challenges within environmental sustainability for scaling pediatric operating rooms? And can you tell us a bit about the landscape or current conversations around sustainability in operating rooms?
Hello. No, doesn't work. Good evening, everyone. We started Kids OR about 5 years ago. Just 5 years ago, this next year in January. I could admit quite easily that probably the first 2 or 3 years we were so focused on scaling up our operations, building operating rooms, training surgeons. That was kind of our core business. But I think latterly we became very aware that we had to find a more environmentally sustainable solution to global aid. We could see ourselves on the ground. Those of us let's look at the continent of Africa. There are equipment graveyards beside almost every hospital that we work in. And we could see the impact that was having. Donors giving either used equipment or brand new equipment. And they're just not being the specialists on the ground to dispose of that equipment responsibly. Also, an issue that we face, which is having an impact on the environment, is a lack of biomedical engineers. So we find that even the newest, best equipment breaks down very easily because of lack of knowledge, lack of servicing. And I think we have to look at donors and how they give. We have to make them responsible for the end of life of that machinery, as well as the servicing and the upkeep of that equipment. I think that will make a big difference. And also looking at our supply chain. We've got to look not just beyond the actual supply in the operating room, but huge issues are around shipping costs and everything else. So we are definitely looking at all aspects of how we can improve what we're doing and the impact it's having.
Thank you. So the opening questions, I think, set the challenges we face, but as I said earlier, this is UN Week. UN Week is all about solutions and how we can work together cooperatively to find solutions to some of these great global challenges. So that's what these next set of questions are all going to be about. Greg, first to you, well, what solutions are there? How do we manage to expand emergency and essential surgery and anesthesia services for rural and remote communities in first-level hospitals and or district hospitals without extracting unnecessary costs from Planetary Health?
Well, that's the rub, right? Yeah. So the IPCC talks about thinking about how you react to and deal with climate change in terms of both mitigation and adaptation. And from the perspective of a surgical system, there are things that systems can do along both of those lines. So mitigation, the idea of like stop making the problem worse, which is what I teach all my residents. When you get in trouble in the operating room, you want to stop making the problem worse and then deal with it. So we have to do the same thing with our effect on the climate. There are things that we do right now. For example, in anesthetic practice, their inhaled agents have significant contribution to greenhouse gases. Some are worse than others. Single-use items tend to, for the most part, be pretty horrible for the climate. It's also, the single-use items are also often plastic, which fuels more of the fossil fuel industry, doing all their nonsense. And so I think if we can have local policies that address these things, then you can begin to mitigate the effect of surgical care on the climate. Another example of mitigating would be having more efficient heating and ventilation systems in operating rooms. There's a tremendous amount of energy that is spent simply running HVAC systems in the middle of the night when no one's there. And that's just a waste of money and a waste of energy. In terms of adapting, I think you have to understand how the climate and climate change is affecting your patient population. There's Gareth can speak to this, but around the concept of the built environment, you want to make sure you're actually building your facilities where they're not going to be at risk of being flooded out. Because if you have a limited budget and you build a hospital in a floodplain and sea rises and floods, now not only have you spent all your money on this wonderful thing, now nobody can utilize it. So you're actually making problems worse. We know that the climate change has adverse effects on surgical patients. There is a link between elevated temperatures and increased risk of surgical site infections, There is a theoretical risk between many neglected tropical diseases, the surgical implications of those things, and climate change. Climate change certainly can, spin off natural disasters, which increases your burden of surgical patients. And so thinking about how you build a system to actually deal with that, but be resilient in the face of climate change is important. But there's obviously no super easy answer, but those are the places we can start.
Thank you. Omnia, to you, we're meeting here just about 6 weeks ahead of COP27. I know, obviously, you will be there, and you'll be focused on the issues that we're talking about today. I guess first, how important an inflection point for bridging that gap between planetary health and sustainable surgical systems will COP27 be? And what will you be up to that week to advance the kind of solutions that we're talking about today?
So first of all, I'd like to share a bit. So this is the first time ever that a presidency for COP decides to have an envoy for youth or a young person within the presidency team. And everyone was also very surprised that this young person comes from a health background and not necessarily environmental sciences. But this is really very inspiring because I remember when I attended my first climate change conference in Katowice, we were around 10 healthcare professionals coming into COP, which is a very political as well as a business conference. And then in the year after in Madrid, our community expanded and we became around 30. And we organized a conference right in the middle of COP that focuses on health and climate change, looking at the health impacts, but also the health opportunities to be integrated within the policy-making space. And as Greg has explained, in the negotiation process, we look at climate adaptation, climate mitigation, but also loss and damage, which is really linked to how healthcare facilities we see in many countries, especially in small state islands, but also in the Asia-Pacific region, the US, where healthcare facilities are destroyed by extreme weather events, be it floods, cyclones, and so on, wildfires. And then in Glasgow, there was a big step for the health community because it was the first time ever we had a health pavilion, which means that we had a space for all the health community, all the health-focused events to take place throughout the 2 weeks of the climate change conference, which was a hub for discussions to start rising, especially discussions related to sustainable surgical care facilities. And the reason why I told this story because I would really love to emphasize the importance of having a stronger presence of the health community, not just at COP, which happens once every year, but to be there at all the decision-making spaces that are related to climate change, because we have a significant role to play. We bring in the science related to climate change and the climate adaptation policies as well as mitigation. We also bring in the urgency and the seriousness to stepping up climate resilience, but also climate ambition. Because right now, countries' commitments are not enough. This COP is not about commitments. Countries have already set their national climate plans. They have already put in their commitments. Now it's a question about implementation. And for implementation to take place, it has to go across all the sectors. And as the health sector, as the surgical care sector, the most intensive when it comes to carbon emissions, we need to be the example that leads when it comes to doing our own commitments, doing our own reductions, but also building our own resilience and adaptation in the face of healthcare, in the face of climate extreme weather events. And I'd like to give a very inspiring example that I've worked with and had a few engagements with, which is an international organization, an NGO actually called Build Health International. And what they do is that they go to countries where they were faced with extreme weather events and they had their healthcare facilities damaged by such events. And what they do is that they rebuild their healthcare facilities, but in a way that is sustainable. So they go to areas like in Haiti and small state islands, and they rebuild their healthcare facilities using solar panels, and this in a way saves a lot of the energy costs, which then feeds into improving healthcare facilities. So it's such a beautiful nexus to reflect on. And then one area I'd like to really focus on is the area of education. And I've personally worked on that. I worked with my organization and we looked at whether climate change was integrated in the medical curriculum or not. And we did this study from 2019 to 2021. We asked 2,817 universities in 120 countries. We asked them 3 simple questions. Is climate change integrated in your curriculum or not? If yes, is it a non-formal element? Is it a formal element? And we asked the students, do you do any activities related to climate change in your own medical faculty? And we saw that less than 12% had a mention of climate change. And the reason why we did this number, because as students we wanted to transform education to integrate elements of climate change, because we as students and as healthcare professionals, we are going to be and we are already the first line responders to the health impacts of climate change. And this number, as little as it is, it was a very powerful number to use with educators, faculty, deans, to really transform our own education. And right now in my medical university, we are designing a new course for climate change to be integrated not just across Cairo but across African universities, so that it is an integral part of education. So if you were to remember anything that I said from my intervention, look at that, because and education as well as residency training. And I hope that this is something that you look at, and I'm there to share all the resources that we have developed so that you can also take it back to your own universities and faculties.
Thank you. So Susie, this week, as every UN General Assembly since 2016, kicked off with what is known as an SDG moment. This is an opportunity for people to start to think about the SDGs, pay attention to the SDGs. Amanda Gorman read a poem, Malala gave a speech, you had high-level presidents and prime ministers shine a light on the SDGs, and a through line through all these conversations is what's embedded in the SDGs, which is partnerships. What partnerships do you think would advance solutions to the kind of questions that we are asking today, and how do we get to those partnerships, how do we implement those partnerships?
I think there's another word too, which is sustainable. And so just to go back, it's not just partnership, because our model of care, of cleft treatment at Smile Train is very much based on partnership. So I will get to that, but as I said earlier, it's also sustainability. And so sustainable is also in all those SDGs. So, you know, I mean, just listening to the conversation is, you know, just so inspiring. And I think, you know, when we think back to when, you know, Smile Train started and Smile Train was founded, and it was this sustainable model of cleft treatment, which is to empower local medical professionals. And, you know, I talked earlier about the conditions that our partners work in, and so to have this conversation today, because, you know, they're operating in low and middle income countries, obviously, but to have this conversation today makes me think about how, as an organization, that Smile Train needs to evolve as we continue forward and take forward our cleft treatment. And that is obviously working with our partners, so that's one level of partnership. And when I say partners, I'm talking about our medical partners on the service delivery of cleft treatment. And thinking of the conditions that they work in, that our team works in, you know, pollution, lack of electricity, lack of connectivity. I mean, here we are, we're a global organization, and we have such challenges just in our work, you know, how we had to be connected during a global pandemic, but how we can meet the needs for our beneficiaries and more untreated cleft that is out there that, you know, needs our attention. But taking that forward into the discussion of sustainability and partnerships, to have solutions, right? A solution is to get somewhere faster, right? To find a solution faster. And I mean, there's always going to be cleft, right? So we know that. but how can we help our partners? How can we strengthen health systems faster? How can we meet the needs of our partners with the equipment and the proper facilities that they need to treat their patients? And how we know we can do that at SmileTrain is if we partner, we can get there faster. So we can accelerate what we're doing if we have good partners. If we're the global cleft voice for the cleft community. So if we work with governments, if we can meet the needs of local medical professionals. I mean, obviously we're focused on cleft treatment, but it is about strengthening health systems overall. And so through partnerships, which one of our partners is Kids OR, and I know Gareth is going to talk about that in a little bit, but how can we accelerate? How can we come together as two NGOs to meet the needs of increasing surgical access? So.
Thank you. So, Gareth, speaking about partnerships, it is my understanding that you have an announcement to make about a partnership between SmileTrain and Kids OR.
Well, yeah, I mean, certainly the last few days here in New York and today has given me a lot of food for thought on what we have to do and go away and talk to our team about having that environmental outlook in all aspects of what we do. And that's something I will go back and work hard on with our team. One of the reasons also I'm delighted to announce that in a joint partnership between SmileTrain and Kids OR, we're ready to launch a unique solar surgery. Our solar surgery system is ready to roll out. It will save 1.5 tons of CO2 from being created each year from every operating room, and it will do so while removing the risk of care being interrupted by power outages. The first of these systems will be deployed in one of our SmileTrain partner hospitals in Africa early next year, and together SmileTrain and Kids OR are excited to be leading the way in delivering improved patient care with a decreased carbon footprint. So thank you.
Obviously, we're thrilled about this. This was meeting the need. This was SmileTrain's regional director for Africa and KOB, who has been working with Kids OR so closely on building out operating rooms at our centers around Africa. But she's working through these challenges, and with lack of electricity, lack of connectivity. I mean, just as I was saying, those issues that our partners face. And so she said to the Kids OR team, like, can't we do something with solar? Like, what can we do? We got to accelerate. And so this is the beauty of partnership and coming together and meeting the need. So.
Thank you.
Yeah.
So we have time for questions from the audience. This is an amazing turnout, by the way. This is great. So wait a moment, and we can call on the gentleman up front. Introduce yourself, ask a brief question. We should have plenty of time. And yeah, already a few questions. So we'll go this gentleman in the front, then back over to you. Go right ahead.
Good evening. First of all, thank you so much for organizing such a wonderful educational event. For a person like me, it's a great education. And by the way, I forgot. My name is Ambassador Malik Nadeem Abid, and I'm the Secretary General of International Human Rights Commission. Two quick questions from the panelists, whoever wants to answer. A couple of days ago, the Secretary General of United Nations, very frustrated, he gave the statement that the nations are still way away from acknowledging climate change. How do you handle a situation like this when the Secretary General of United Nations is so frustrated with this? The second question is just like the Excellency Prime Minister and Dr. Tedros mentioned, the floods in Pakistan. If you don't know, those people who are not aware, 30% of Pakistan is under feet and feet of water. No hospitals, no roads, no communication, no bridges, and of course, no operating rooms. So what can we do, or what help can we get in this situation? And thank you so much once again.
Thank you. Would you like the first part on climate and inspiring climate action? Then we'll do a question about perhaps surgery in emergency humanitarian situations such as what's going on?
Yeah.
Thanks, go ahead.
Yeah, so this is a very important question, and I think this year, with the presidency team for COP, we realized that even, there are two main issues. One is the inadequate, political will and commitment to climate change and prioritization, despite how we are now seeing the impacts of climate change accelerating and affecting nations worldwide disproportionately as well. And the second issue is that when it comes to the climate space or the decision-making space, there is a lot of attention and commitments towards climate mitigation and reducing carbon emission versus investing in adaptation, especially that more countries are suffering and do not have the finance to do that. So this brings into the biggest elephant in the room, which is climate finance, because many countries as well as the private sector not really putting in investments in climate finance. But this is what we want to do this year, being in Egypt as the COP27 presidency, is that many countries have already submitted their plans so that we do achieve the Paris targets, which is reducing or limiting the increase in temperature to 1.5 degrees. And this is one entry point that we have as the health community or as individuals, is that our country is committed, and we see the commitments, it's right there on the UNFCCC website. We need to mobilize the public pressure that is needed to ensure that our countries are implementing the commitments that they already said that they would do. And then at the same time, we need to put in the pressure needed into mobilizing the finance, because there is many, like grants and philanthropies in the private sector investing in climate finance, where we need to see where is it being, is it reaching those who need it the most, and then at the same time, really putting in the opportunity when we are adopting sustainability, because the climate agenda or being sustainable is also, it has its own return on investment. You put extra investments in being sustainable, but there is a return that is going to especially return back on the healthcare sector. So this is a case that we need to make it, but we are still very far behind as the health community to communicate, to make that economic and business case especially for climate adaptation, but we need that more than anything. So we have the power to bring in that political will and to drive that urgency, but also to make the case using the health argument as WHO used last year in Glasgow. They developed a report called the Health Argument for Climate Action.
I'll go on to the ambassador's second question, unless someone wants to build on the first. Okay, so the second question, focusing on opportunities for sustainable surgery in emergency humanitarian contexts, such as these epic floods underway in Pakistan. Craig, do you have any thoughts on that?
Unfortunately, in the situation of Pakistan, the horse is out of the barn at this point, and it's a matter of needing to help the people that are being affected. I think once the international community will obviously need to mobilize to help with that, because Pakistan is going to be in a situation, is in a situation right now where their healthcare system is going to be overwhelmed. I think what I would take away from that is hopefully everyone will see this as somewhat of a canary in the coal mine and be able to say, this could be our country. And we need to really think about what we're doing to the climate and whether our healthcare system is resilient enough to absorb some of these significant events, particularly nations that are likely to be more affected by climate change, equatorial nations and island nations. It's unfortunately, I think, to kind of answer your first question also, climate change has become a very political thing, and unfortunately, it's you can make the analogy with how the United States handled the COVID-19 pandemic. I mean, we lost the plot when it became a political thing to wear a mask or get vaccinated, or nonsense. And unfortunately, I think that's what we have to move the topic of climate change away from, is, you know, who's going to pay for it, who's going to do this. It's something that affects every person on this planet. We all have a stake in it. And, you know, if nations like Western Europe, you know, United States, Canada, et cetera, want to hold themselves out as these international leaders, here's a great opportunity. And I would look at it as that we are missing a golden opportunity to fundamentally transform how we provide energy, how we think about healthcare, how we think about all aspects of society that all feed into the exacerbation of climate change. So.
Yeah, we'll go to you. Just wait for the mic, and it'll be best. Yeah, right there, this gentleman. Thank you.
Thank you very much. I'm Ambassador Parson, and I'm here in my capacity as chairman of the board of the G4 Alliance, the Global Alliance for Surgery, Obstetrics, Trauma and Anesthesia Care. First of all, congrats, wonderful presentation. Thanks to all the co-developing partners here, and congratulations on some growth. My one concern about this conversation, first of all, it's a great conversation, but I think I wanted some definition on the word sustainable as it stands in that, how thematic this is. The reason I'm saying this is, you know, back in 2010, the SDGs came about, we all focused on it, and the world's definition of sustainable is arguable. Some say it's environmental, others say it's environmental, economic, social. My colleague from Cairo made a point, the investment dollars coming in. Every single investment firm right here in New York will tell you, you want my investment dollars, look at the ESG for you, environmental, social, governance. So this group, as you know, thought leaders in this space, I think we probably need, it's a question/comment, I think some thought needs to go into what is the social aspects of this challenge as well, the diversity, the inclusion, etc., if we are to meet those investment needs. But also there's great ambiguity, if not obsolescence at the moment, with governance. The governance framework around sustainable surgical systems and planetary health. So I would love the commentary of the panel. By the way, congrats. Awesome effort with the solar.
Thank you. Susie, you
thank you. Yes, I mean, right, how many times have I said sustainable tonight? But you're right. I mean, it's exactly that. How do we look at things, how do we come together to really focus on sustainability, right? How do we empower local governments, and how do we advocate? And as I said, for Smile Train, and I'm not even sure if I'm really answering your question here, but for Smile Train, when we think of our evolution and how we are going to work with our partners, we have to keep this in mind, right? This is a global concern. It's a global crisis, even though people don't want to admit to climate change is a global crisis. So as we continue working with our partners and continuing our work, it has to be at the forefront. So I think it's finding those solutions, right? How do we find these solutions, which is like how Kids OR and Smile Train are coming together to meet that need, which was a specific need from our own team. This was our Smile Train team in Africa who said, we have to find a solution to this because these are the challenges. You might not see this where you are in the U.S., but these are the challenges we have. We don't have electricity, we don't have running water. It's one climate crisis after another. So how can we provide, for each other? And we're here, we're providing for our partners in Pakistan. I mean, thankfully, none of our medical partners are directly affected. Our hospitals are still in operation. In Pakistan, they're able to treat patients, but you know that there are patients that are affected someplace in Pakistan, cleft patients, that is, obviously. won't have access to care. So eventually when all of these challenges are looked at and we're able to, get around them as an organization and support, there's going to be a backlog of patients and that impacts them because of that. So this is how organizations have to come together.
Thank you. Did you want to add something, Gareth? We can move on to the next question.
That's fine.
Okay, great. Go right ahead. Yeah, this person in front. Thank you.
Thank you so much for talking about this very important issue. My name is Mary Zagam. I am from the program of Global Surgery and Social Change from Harvard. I just started my journey as a global surgical advocate, and having you guys talk about surgery inspires me a lot. Giving you a challenge here, all of the panelists, if I and my group was to raise $100 million today, what were the 2 things that you will invest on immediately? This is the whole panel.
This is a good lightning round.
Yeah. Thank you.
I'm going to go down the line. Go ahead,
Good question.
It's a really, really good question. First of all, I'd say give it to Kitsuwara. But if you want a real answer, I think training of local people to care for their own nation's children is absolutely key. When we started Kitsuwara, that was our mantra from the very beginning, that it had to be local people caring for their own nation's children. And we set out looking at that model where we would strengthen healthcare systems. I mean, historically, a lot of surgery has been met with mission-based work. And we just felt that really if we're going to live forward and be sustainable, is that the right word? If we're going to do this properly, we really need to invest in people. And I think if you've got 100 million, I mean, there's a huge need for training biomedical engineers as part of the surgical team. Slightly overlooked, but just a huge need, and it impacts on so much of the surgical process. And obviously the key elements of the surgery, nursing, anesthesia, surgeons, all of the community. Yeah, it's something that's training people. The workforce is absolutely key in low and middle countries. That's where I put all your money.
Thank you. Susie.
You stole my line, but I think that just shows how aligned we are as 2 organizations to come together in the way that we have been and the way we are now going forward with our solar approach. But yes, it's education and training of local medical professionals. For us at Smile Train, it's being able to provide for a holistic approach to cleft care, so that's training speech therapists, orthodontists, psychosocial support for our patients. It's the whole package. My ENT team, part of them are here, and I'm sure they're like, yay, because this is it's such an important focus of our work. And as Gareth also articulated, it's a different model than the mission-based model, which was the model yesteryear. We are now going forward. It's, sorry again, sustainability, and yeah, so I'll take that 100 million and put it towards the education and training of global medical professionals.
Omnia, how would you spend $100 million?
So my answer will not be biased at all, but I will give it to UNGA. No, but it's something that I learned, through my role as well as working with different youth-led organizations and youth groups, and seeing how much impact young, experts and young people have working directly with the community, being at the front line, but also having very little resources, to do an awareness campaign, or to do a workshop, or to help those in need and give them, right now many countries around the world are facing, decreased, acute either food insecurity or water insecurity because of climate change. It basically means that communities seek is not there because of the changing climate. And then I see many inspiring young climate activists and innovators and solution makers going to these communities, but also needing a lot of funding, but not getting access to because they don't have the organizational structure to do it, they don't have the like the technical expertise when it comes to being registered as an organization, being just an independent young group and not getting access to the funding that they need. So I will invest in that, but I will also invest, it's not just invest in that very committed, active young capacity, but also investing in rebuilding health infrastructures, because this is one of the key areas that is being impacted most by the extreme events that we're seeing, and we're seeing it not like in one-off times or like on rare occasions, we're seeing it all the time, everywhere around the world. And the health sector is also one of the sectors that still lacks a lot of funding. As I said, like only 2% of climate finance goes to adaptation, and I cannot imagine how much of that adaptation finance goes to the health care facilities. So we also need investment in the healthcare facilities to adapt and to build resilience, because one of the lessons we learned from COVID is that our healthcare facilities are not resilient enough. They were not resilient to COVID, and they're most certainly not resilient to the climate crisis.
Thank you. Great.
So everybody in here is obviously very interested in global surgery, and one of the hot topics in global surgery is ENSOs, since the Lancet Commission came out and recommended that. Several countries have developed ENSOs, but really nobody's been able to implement them. And one of the main reasons behind that is a lack of funding. And so I think if somebody gave me $100 million, although I'd be tempted to buy a share in Liverpool Football Club because I'm a masochist, I think the best place to invest it would be in actually putting forth effort to fund implementation of real national surgical plans with a particular attention to climate change. We've recommended, we put a paper out a few months ago looking at how climate change needs to be incorporated in national surgical planning in the Western Pacific. And there are opportunities for countries to not only do good things for the planet that will hopefully ultimately positively affect their own countries, but also save a lot of money. It's the amount of money that's wasted on things that actually are bad for the climate and healthcare is astounding. So I would put money towards actually funding implementation of national surgical plans. I can tell you, I reviewed a grant recently for some folks in the UK, and the grant was all about trying to take single-use drapes and surgical gowns and get rid of them and use multi-use cloth drapes. And the amazing thing is the grant wasn't about whether this is a good idea or not, because they presented all this evidence that, yeah, people have looked at this and it can save the NHS literally like hundreds of millions of pounds over a long period of time. It is not only more cost efficient, but they looked at the landfill and carbon impact of it, and it's all like what you would think it is. It's great, but it's just a matter of inertia. You know, the NHS, this is what they do, and there's regulatory agencies that have ridiculous, unfounded fears of infection that scientifically don't exist, and so there are opportunities to save a tremendous amount of money if healthcare systems will think a little bit more about how to incorporate climate change into what they do every day, particularly surgical systems. So.
Well, thank you, and that's a great note to end it on. Unfortunately, we are out of time, but fortunately, there is a reception right after this, which our panelists will attend. You can ask them your questions directly there. The reception is at Harvard Hall, which is somewhere in this building. I'm seeing downstairs.
Second floor.
Second floor. They will be guides taking you there, because apparently it's hard to find, but I have confidence in this group. Thank you to our panelists.